What is the kidney? Now, the kidneys are two organs located at the back of the abdomen called retroperitoneum. Now, the two kidneys together filter approximately 150 to 180 liters of primary urine.
The kidneys are two essential organs in our body without which life is not possible.
What can cause the kidney to get sick?
So, any disease that causes the kidneys to fail in their function should be a cause of concern for everyone. There are reasons enough why each and every one of us should be concerned about the functioning of our kidneys. Amongst many causes of kidney diseases are infections, medicines, dehydration, diabetes, and hypertension, just to mention these few. It means that the chances that every one of us would one day be affected by one of these causes, which might eventually lead to kidney problems, is very high. So our attention to kidney diseases should be the concern of everyone. However, the problem with kidney diseases is the high cost to treat them. This is one of the major reasons why people generally don't see the essence to go for regular medical checkups with catastrophic consequences for many. It is in this light that the Atanga Kidney Foundation came to exist. The Atanga Kidney Foundation is a story of a brave woman, Mrs. Rosemary Ngasab Atanga. Born in Cameroon, Mrs. Atanga grew up in Bamenda. The only girl child of 6 children, she was brought up by very strict parents. She did her secondary education at Our Lady of Lourdes Secondary School, a Catholic institution only for girls. Upon completing her secondary education, the young Mrs. Atanga went for her university studies that saw her emigrate first to Nigeria, where she obtained a Bachelor of Science in Agricultural Economics from the University of Maiduguri, and before moving on to obtain a Master's in Business Administration from the Strayer University in the United States of America. Everything seemed to be evolving very delightfully for Mrs. Atanga until the day when destiny knocked at her own very door.
Ladies and gentlemen, if you don't know me, I'm Chris Atanga, son of Rosemary and Chrysanthus Atanga. And I also want to share with you some information on how the foundation first came about. When I was 2 months old, as an infant, my dad was diagnosed with kidney failure. And at 5 months, my mom made the brave choice to donate a kidney to him. Without this choice, my dad wouldn't be alive today, and it changed almost my whole life because I wouldn't be able to even grow up with my dad.
Testimonies from friends and family members describe Mrs. Atanga as a carbon copy of her late mother, who before her sudden death at the age of 45 years was well known for her friendliness and generosity. This attitude has been demonstrated many times by Mrs. Atanga, who regularly travels to several African countries for humanitarian activities. For example, as a volunteer of the Pacha Foundation. It will be noted that when Mrs. Atanga was still a university student, she helped to finance the tuition fees and feeding of a fellow student for 4 years in the university when she discovered that he was from a poor family. The story of the Atanga Kidney Foundation wouldn't be complete without the mention of another Cameroonian son in the person of Dr. Emmanuel Anyangwe Ngasa, a general surgeon living and practicing in Germany. Dr. Anyangwe Ngasa grew up in Ghana Street, a popular quarter in Nkwen in Bamenda. He attended the Roman Catholic Mission Primary School in Bayele in Nkwen and went to Sacred Heart College, Makan, still in Bamenda, which is a boys' only secondary and high school run by the Catholic Church. In October 2014, Dr. Anyangwe Ngasa launched his popular program called Ask Doctor.
Asaroto, when I welcome for this first episode for Ask Doctor.
Ask Doctor is an audio-visual platform in which Dr. Anyangwe Ngasa makes use of his vast network of specialized medical doctors to educate the general African public in medicine using Pidgin, the language that most people in Cameroon and some other West African countries understand. As Mrs. Atanga herself confessed, it was after having watched Ask Doctor that she was strongly motivated to put into practice a desire she has been nursing for 6 years to actively promote kidney disease awareness in the world, especially in Africa. The fact that she wasn't a medical doctor was to her a major handicap in launching a kidney foundation. Nonetheless, she contacted Dr. Anyangwe Ngasa and sought his opinion and advice. Dr. Anyangwe Ngasa quickly bought into her idea to launch a kidney foundation and encouraged her to go along, promising to back her up with his medical expertise. As Dr. Anyangwe Ngasa himself put it, it is a way of giving back to the Cameroonian and African society in acknowledgement of all the opportunities the society has given to him. After a short but intensive period of preparation, the Atanga Kidney Foundation was launched on September 19, 2015 in Washington, D.C. However, even before that, a crisis engulfed the Bamenda Dialysis Center in the northwest region of Cameroon in August 2015 due to shortage of urgently needed medical supplies, including the dialysis water called dialysate. The Atanga Foundation, even though still existent only on paper, was quick to react and successfully solicited urgent funds from some benevolent donors, which were promptly channeled to the dialysis patients in Bamenda and billed through their representative, thereby saving the lives of many. Despite the intervention of the Atanga Kidney Foundation, a total of 8 dialysis patients didn't survive the crisis and died. However, it was a turning point in the history of kidney disease support in Cameroon. From December 2015 to January 2016, the Atanga Kidney Foundation, in a first of its kind strategic partnership with Ask Doctor, jointly organized training sessions for medical professionals and patients in 2 dialysis centers in Cameroon, after which the participants were issued attendance certificates. The first session was held on December 29, 2015 at Bamenda Regional Hospital. A medical team from Germany, led by Cameroonian-born nephrologist Dr. Moses Nkwenti Teka, carried out the trainings. The team also included a German couple, Mr. and Mrs. Detlev Mansfeld, both of whom work as dialysis technical assistants and trainers of dialysis nurses. Another medical doctor on the team was Cameroonian-born Dr. Eunice Mbo, who, like Dr. Teka, hails from Huyin. Dr. Mbo is a general surgeon and traumatologist. On 30th December 2015, a first-of-its-kind conference on the awareness of kidney diseases was organized at the Ayaba Hotel in Bamenda, which was opened to the general public for free. A second training seminar was organized on January 4th, 2016 at the Booyah Dialysis Center. During all the three occasions, it became obvious that some work has already been started by the Cameroonian Ministry of Public Health. For example, the government has already established 12 dialysis centers in some regions. However, the amount of technical facilities which are needed, including the life-saving dialysis machines, are still very insufficient. Due to such shortages and the many chronic problems affiliated with running such dialysis centers, dialysis patients in Cameroon receive averagely only 2 sessions of dialysis of a maximum of 4 hours each per week, instead of internationally recommended 3 sessions per week. This is a major reason why the rates of complications of dialysis patients in Cameroon remain frighteningly very high. Kidney disease, especially in its end stage, is tantamount to a death warrant. The Atanga Kidney Foundation, together with other sister organizations, are standing up to say no to that. We no longer want to sit and watch our children, family members, friends, and others just wither and die. The Atanga Kidney Foundation is a non-governmental organization that has come not only to mobilize awareness of kidney diseases in Cameroon and Africa, but also to mobilize efforts to bring about a change of mentality in our African society that will have a lasting impact in the prevention and cure of kidney diseases. We are a team of dedicated people of all walks of life under the leadership of a constantly growing competent team of specialized medical doctors, including nephrologists, surgeons, anesthetics, neurologists, oncologists, and so on, based in and out of Africa. We are partnering up with the government in different African countries to bring about the long-awaited change in health development. The Atanga Kidney Foundation is simultaneously pursuing 2 goals. Firstly, we are building up partnership with local and international companies and institutions, including university teaching hospitals, to train the personnel on the field whose engagement is paramount in the delivery of effective health services in our communities. In this light, we are proud to single out the example of our upcoming partnership with the Ministry of Public Health in Cameroon to train nephrologists and dialysis nurses in many dialysis centers across the country. One of the primary goals that we want to achieve within the next 2 years is to increase the number of dialysis centers in Cameroon where badly needed fistula surgery can be done, so that patients shouldn't have to spend their last resources available to travel to the only 2 centers in Cameroon where fistula surgery is offered. It doesn't only cost the patients money, but also energy, and some of the patients don't survive the trip. Secondly, the Atanga Kidney Foundation offers humanitarian help to the most needy of kidney patients.
I'm in fact a very happy person that part of my objectives have been realized, because I can see a little girl whom we're thinking she has no future, suddenly becomes alive from the promises that we've had, and I know she will be attended to.
Yes.
There are other patients here who I think the foundation have seen, and they will ask us to give their names, and they will, in fact, help, though they cannot do all at once.
No.
The cost of dialysis session in Cameroon today is 5,000 francs. Dialysis patients need at least 3 sessions for 4 hours per week, as it is obtained in the Western world. But because of lack of enough dialysis machines all over Cameroon and the constant rising number of dialysis patients, dialysis is offered only twice a week for 4 hours each, sometimes even shorter, in order for more patients to share the dialysis machines. This situation is not acceptable, taking into consideration the low income that prevails in Cameroon and again the high level of unemployment nationwide. It's obvious that even the average 2 sessions of dialysis per week at 5,000 francs each is still a very huge burden for many Cameroonians. That's why the Atanga Kidney Foundation is also trying to identify the most needy of the neediest and support them financially in order to give them some bit of dignity in life. In this light, the Atanga Kidney Foundation will welcome any form of material or financial support to help it carry out more of such charitable activities. If you are interested in supporting the activities of the Atanga Kidney Foundation, you can go to our website and choose the form of support which you intend to give. So, instead of making a donation to individuals or groups with little transparency in their activities, place your donation in the hands of the Atanga Kidney Foundation. Remember that your donations are tax deductible in many countries. Meanwhile, have you ever thought of becoming a volunteer or an outright member of the Atanga Kidney Foundation?